Afternoon, guys. My name is Dr. Arvin. So I'm going to talk a little bit about hamstring strains today. So if you're not sure what a hamstring is actually the muscle at the back of your thigh that actually functions to either flex the knee or extend the hip depending on where it's being applied. So this is one of the muscles that is commonly injured, and it actually can be a very notorious muscle to be injured because it can take anywhere between weeks to months to get better. And you see it very, very commonly among sprinters, people from the long jump, high jump athletes, and you can even see in the football players as well, very commonly. And if you have seen or watched football, you know that sometimes it can take weeks to months for them to get back to gameplay, and this causes quite a bit of distress not only to the team but also to the player because it's a loss of a player. And if it's in a single event, it's also a big deal. So hamstring strains can be anywhere between 12 to 16% of all injuries that occurs, and is as high as 55% of all muscle injuries that occurs, and that's a very big number actually. So there are many reasons why the hamstring is commonly injured, okay, and the biggest reason is normally because of fatigue. Sometimes previous hamstring injuries, recurrence rates is quite high. It can be anywhere between 30 to 50%. And improper warm-ups, core muscle weaknesses. There's some coordination problems between the trunk and the pelvic muscles, and sometimes because of lumbar posture abnormalities. Now, those are the risk factors for a particular hamstring injury. But what are the mechanisms for hamstring injuries? And there are actually two very basic mechanisms. One of it is actually a passive hamstring eccentric lengthening. Basically, what happens is that when, like a hurdler, what happens is the hip goes into flexion along with the knee going into full extension, and that puts the hamstring in a very, very high stretch position. And this commonly can cause avulsion of the proximal hamstring, which is near the pelvic region, and that's very, very notorious for healing. It doesn't heal very well. Sometimes it can take months, to get any better. And the other way to get hamstring injuries is an eccentric phase followed by a violent concentric phase. Sometimes you see some people yanking the leg curl machine. When it's about to get done, you try to yank a very heavy weight, and suddenly you feel like a snapping sensation or a tearing sensation with the hamstrings. And normally this happens in the muscular-tendinous junction. So when we talk about muscular-tendinous junction, so if you see a muscle, okay, so where the muscle actually attaches to the bones, okay, normally the muscles actually turns into tendon. This is red, but actually turns a little white here. And this particular area where it turns into a tendon, and there's a junction between where it turns into a tendon from a muscle, where it turns into a tendon, it's called the muscular-tendinous junction. That particular area is very sensitive to injuries and it's very prone, and the hamstring particularly is actually quite prone to injuries. Now, when you're talking about hamstring injuries, the most common hamstring to be injured is the long head of biceps, femoris, okay, because that's the muscle that attaches from the ischial tuberosity in the pelvis and goes right down to the fibula where it gets attached. So it's a muscle that actually crosses two joints, and that itself is a risk factor because the movement of one joint affects the movement of the other joint, and when you have a hip flexion with the knee extension, it puts the muscle in the most stretch, and that is why it's vulnerable. Now, when we're talking about hamstring injuries, now we also want to talk about how do we get past this problem, because it's such a common injury. We need to find ways to improve this or prevent this from happening. So Torborg et al. Has actually mentioned in 2012 that strategies to actually help the eccentric phase, or accentuating or improving the eccentric phase of the hamstring, can actually reduce injury rates by 60%. That's quite a bit of reduction. So the two most commonly employed exercises that you see amongst field sports team and athletics teams is the Nordic hamstring curl and also the glute ham raise. Now, the Nordic hamstring curl is a bit easier because you don't need machines, you just need a partner, and you can actually do it at the field. And you can do it in both ways. You can either do it by just focusing on the eccentric phase. Basically what happens is the athlete drops up to about 45 degrees and allow you to drop all the way down, and you dampen the fall with your hand, then you reset and you try it again. So you do this anywhere between 3 to 5 repetitions. Now you'll see some amazing videos where guys can get all the way down to the ground and get all the way up. This is where actually you're focusing on both the eccentric and the concentric. I mean, that's an exaggeration. Not many people can actually do that far, and it's not necessary. If you can get down to about 45 degrees to about 40 degrees and then get back up, that's where you are actually emphasizing both the eccentric and the concentric phase. So these two particular forms of doing the Nordic hamstring curls have been shown to actually improve the rate of hamstring injuries. The other one that actually can be helpful is the glute ham raise, but for that you need a particular glute ham raise machine, and you can actually can be done with a very basic or a beginner level or right up to the advanced level depending on the setting. And that is a good one to focus both the concentric and the eccentric phase, the eccentric and the concentric phase, and you can do it in many ways depending on what you're trying to accentuate or what you're trying to improve. Okay, now those are more for sprinters and athletic population and the footballers and so on, because they need the ability to lengthen and contract on time, because they have a lot of change in direction, braking and accelerating and those kind of things happening in their sport. Now, how about powerlifters or weightlifters? Now, like powerlifters, their biggest job is to do one concentric pull of a deadlift. Okay, the eccentric phase is not really important. Okay, unless you're trying to improve your strength in training, but in the sport per se, no, it's not. Okay, so things like Romanian deadlifts, stiff-legged deadlifts are far better in improving the hamstring stretchability and also improving the strength of the muscle. Leg curls is another way to directly activate or work the flexion of the knee, where it also works the hamstring from the bottom end. The RDLs and SLDLs works the hamstring from the proximal end. Now, other things that could also help is the good mornings. Again, technique is very important, this so they don't strain your back. So these are the exercises that can be employed by powerlifters or weightlifters to improve their hamstring capabilities. The squat isn't exactly the best exercise for hamstring. You see the EMGs, the hamstring has a very small EMG when compared to any other muscles that are activated during a squat. So the reason why eccentric training actually improves the flexibility of a muscle is by this process called sarcomerogenesis, and to extend the pliability of the tendons as well. Sarcomerogenesis simply means there's more sarcomeres being added on to the muscle fiber per se. Okay, so that's one way it improves the flexibility of the muscle, and also to a certain extent the joint mobility as well. So I hope this actually clears the doubt about hamstring strains. That I've just posted up a IG post about it if you want to read further, but this elaboration should actually clear quite a bit of doubts. So I hope you guys learned something today. Thank you.